Hi, welcome to Home Buffalo, Osteopathic Wellness Medicine. I'm Dr. Leonard Kaplan. I'm here today with Jess. Okay.
Hi.
Thanks for joining us. Thanks so much for
Thanks
doing the interview. We're going to talk about sacroiliac joint pain and pregnancy today. It's a very common problem. It happens to a lot of women during pregnancy and really plagues them after pregnancy as well. It can be very, very painful, and interestingly enough, very, very simple to fix with a procedure that we call Prolotherapy. So Jess, you've had some issues with your sacroiliac joint on and off. As a matter of fact, the first time we met, it was a little out of alignment, and that's how we met.
Yes,
I corrected the joint back into alignment.
Yeah.
You've had two beautiful kids over the span of 2 years, and right at the time of your first pregnancy, you started to have some issues with your back again. So tell me a little bit about that.
Sure. So I have, my hips are kind of hypermobile to begin with. So I had a little bit of SI pain, occasionally going out of alignment before pregnancy, but during pregnancy with my first, it was happening on a regular basis and really starting to cause a lot of pain through my low back, through my legs, throughout the entire pregnancy. And then after actual birth of my first, my son, giving me so much pain that I could hardly walk. So my savior, Dr. Kaplan here, helped me with prolotherapy all through around my sacroiliac joint and into my hips. And the best thing I would have to say about it is I bounced back very quickly. So within a couple days, I was able to take care of this beautiful little baby. I couldn't imagine not being able to lift him up to go up the stairs with him. So yeah, even in a couple of days, everything was just tightening up, and I was able to walk without pain.
And it took one treatment.
One treatment, and that was maybe a month or two after he was born. Now with my second, so I had some issues during the pregnancy, not as much as Fox, and maybe just from the tightening of the first round, but as soon as I had her, within 2 days, I could not walk without pain, tears in my eyes, pain. So again, I came back, and one treatment 3 days after she was born, and I was walking again without pain.
That's
so
amazing.
Really a miracle and life savior for this high emotional time with two little kids, and the possibility of not being able to take care of them on my own was scary. So this was really helped me get back to daily life.
So I remember you walking in, and you were literally waddling like it looked like you were walking on glass.
Yeah.
With bare feet.
The pain was excruciating, mostly with going upstairs. I couldn't even do it. I had to use a cane in my house, it was tough to, especially I'm not very old, I'm in my early 30s.
Very young.
Very young. So the thought of this idea of not being able to take care of my kids or walk without a cane, it was really, really scary, but the fact that I knew you was like the light.
And the treatments are fairly quick.
Yeah.
I mean, maybe all of about 20 minutes.
Yeah.
There is a little bit of discomfort with the treatment, but it's not horrendous at all. So treatments work very well. Of course, strengthening of muscles is very important afterwards. And sometimes we need a little bit of maintenance, because sometimes the joints start to loosen as you get more active. You're picking up your babies, of course, so you still work in that area. So, but overall, it's a great treatment, elegant, simple, a quick solution. So if you wanted to learn more about sacroiliac problems, go to our website, homebuffalo.com, or give us a call, 716-626-6301. Thanks for joining us today. And again, I'm Dr. Len Kaplan, Home Buffalo. Thank you.